In the 1980s, there were men showing up at hospitals in New York as well as in California with a cluster of conditions that the medical community weren't used to being grouped together. These conditions included PCP, progressive cancers such as Kaposi sarcoma, immune deficiencies, muscle wasting, and even death. In 1981, there were 270 men that were recorded that had these cluster of conditions. Of those men, 120 of them died by the end of that year. HIV was originally referred to as GRID, or gay-related immune deficiency. It was not until 1982 that this phenomenon was termed human immunodeficiency virus, as the medical community was quickly discovering that gay men weren't the only ones affected by this disease. There are two types of HIV. HIV-1 is the more common HIV, and it's found all over the world. It has many groups and many subtypes. There's also HIV-2, which is more common in West Africa. It has been seen in places such as the United States and Europe. I'm assuming because people from West Africa are traveling to these locations. One of the differences, though, between HIV-1 and HIV-2 is that the immunodeficiency in HIV-2 is occurring at a slower rate than in HIV-1. HIV is defined as a blood-borne virus that enters the body through contact with infected fluids. These fluids can include blood, which there was a time in the 1980s where people were receiving HIV through blood transfusions, and this is adults and children alike. Once the medical community became aware of this, they started a screening process where they would test the blood for HIV prior to distributing it to other people to keep them from getting sick. HIV can also be received through semen, vaginal fluid, and breast milk. It is less common to get it in breast milk, but it still does occur. The way that HIV affects the body on a cellular level is through CD4 cells. And CD4 cells are a type of lymphocyte which is responsible for removing foreign objects as well as initiating the body's response to infection. So what happens is the HIV enters the CD4 cell and immediately starts making copies of itself. Once the CD4 cell is damaged, then it eventually dies off. So in a healthy person, the CD4 count is anywhere between 500 and 1200 per cubic micrometer. Once HIV enters the scene, it can drastically drop those numbers to below 500. HIV can actually destroy up to 1 billion CD4 cells daily. The smaller the number of healthy CD4 cells, then the less the body's immune system has a chance to fight off the illness. Lymph tissue can be found in the lymph nodes, the spleen, and the thymus. While the T cells are produced in the red bone marrow, they migrate to the thymus to mature. So HIV affects the tissues by causing fibrosis of that lymph tissue, which makes it nearly impossible for the CD4 cells to survive. When an infected person's CD4 cell count is within normal range, they are less likely to succumb to the opportunistic infections or the infections that occur when the immune system is weakened. When the immune system starts to be affected, multiple organs can be affected either separately or simultaneously. Opportunistic infections become more prevalent once the CD4 count drops below 200. And dealing with the digestive system, people with HIV can develop candidiasis, which is commonly known as thrush. It's characterized by white patches on the tongue and the mucosa of the mouth, and also can go further down the digestive tract. It can cause discomfort and cause the person to have inadequate nutrition because of the discomfort. If a person starts to lose weight and loses 10% or more of their baseline weight, then they go into what is called wasting syndrome, in which they can take appetite stimulants that could help with this condition. There's also hepatitis, which is an inflammation of the liver. Now, you can imagine why your liver function is important because it functions to filter blood through the system as well as metabolize chemicals. And dealing with the respiratory system, HIV can cause PCP or pneumocystic carinii pneumonia, which is the most common type of opportunistic infections, and it causes recurrent pneumonia. There's tuberculosis, which is characterized by cough, fever, night sweats, and weight loss, and can affect the lungs as well as other parts of the body. And then there's cryptococcuses, which can affect the brain and meninges, but also affects the lungs as well. Because HIV attacks the lymph tissue and the lymph nodes, the entire immune system is compromised. So infections that can occur include cervical cancer, non-Hodgkin's lymphoma, and Kaposi sarcoma, which is the most common form of cancer in AIDS patients. In dealing with the nervous system, HIV can affect the brain by causing HIV encephalopathy, which the symptoms are similar to those with Alzheimer's. So the memory is affected, the balance, equilibrium, concentration, and behavior are all affected as well. There's also primary lymphoma of the brain, in which in this condition the prognosis is very poor. And then there's toxoplasmosis. Typically, we think about toxoplasmosis um, as being a condition in pregnant women who handle kitty litter. Well, it can also occur in HIV patients and can cause motor weaknesses and speech disturbances as well. On a multi-system level, there is a condition called cytomegalovirus, which can affect the digestive, respiratory, and nervous system all at once. And it causes conditions such as colitis, pneumonia, as well as brain damage. HIV can be broken up into three stages. There's early, intermediate, and late chronic infection. The early stage is termed acute infection or acute retroviral syndrome. At this stage, there is a large amount of virus in the blood. The blood initially recognizes the virus as possibly the cold or having flu-like symptoms such as fever, body aches, fatigue, and night sweats. Because these symptoms are vague, the person is likely to ignore these symptoms or label them as just a simple virus. But unlike the common cold or the flu, this virus is here to stay. In intermediate chronic infection, progression of the virus can either plateau for a few years or advance. With the CDC4 count anywhere between 200 and 500, opportunistic infections can begin to arise. Some of the common opportunistic infections at this stage include candidiasis, Kaposi sarcoma, genital herpes, shingles, and leukoplakia, which is a raised white painless tongue lesions. During this stage, those with prior vague symptoms may now consider treatment due to the severity of the illness or combined illnesses. Once the CD4 levels reach less than 200, the infected person enters the late chronic stage or AIDS. The decrease in CD4 cells leads to one of over 25 infections that occur when the immune system is compromised. This term of infections or this group of infections are called opportunistic infections. I have discussed many of these opportunistic infections before, but they can include candidiasis, herpes, cytomegalovirus, Kaposi sarcoma, non-Hodgkin's lymphoma, tuberculosis, PCP, and wasting syndrome. Um, some of these infections can cause a person to be disabled and also may cause death if the condition is left untreated or if it gets treated late in the infection. Psychologically, a person can encounter a number of emotions. Some of the things that they can encounter are fear, denial, bargaining, acceptance, anger, anxiety, and even suicide. Here's a slideshow that I found on the CDC website. As you can see on the left side of the screen, there are statistics, and then on the right side of the screen, the statistics are broken down into groups of people. So in 2010, there were 47,500 new HIV cases in the US. In 2011, 1.2 million people were living with HIV in the United States. Of those, 14%, which is approximately 168,000, were unaware that they were infected with this virus. The United States spends millions of dollars annually on HIV prevention programs. The prevention is aimed at avoiding risky behaviors that could involve exposure to bodily fluids. For example, HIV can spread through contact with dirty needles, so there are needle exchange programs in place that provide clean needles to HIV drug users in exchange for their used needles. However, because only 1 in 5 cases of HIV is related to the use of needles, the primary focus of prevention is based on abstinence and safe sex. For those who choose sex over abstinence, there are many forms of condoms, such as latex condoms. For those who have latex allergy, other forms of condoms are available in lambskin and polyurethane. Infected women have a 30% chance of passing the virus to their offspring. If antiretroviral medications are used or are given during pregnancy and labor, then the infant's chance of contracting HIV decreases from 30% all the way down to 2%. For this reason, women are encouraged to have HIV testing during their pregnancy in the early stages and once again in the late stages. Among the groups that contract HIV at a higher rate are young people between the ages of 13 and 24, homosexuals, as well as African Americans. While there is no cure for HIV, there are many clinical trials that are aimed at prompting the immune system to produce antibodies against HIV. In the meantime, there are more than 30 antiretroviral medications that focus on maintaining a healthy immune system. These medications help to decrease the viral load, raise the CD4 count, and delay the onset of HIV-related symptoms by decreasing viral replication and delaying the process of HIV itself. Even though there are side effects related to the antiretroviral meds, providers have the opportunity to alter the medication regimen to reflect the best outcome and the least amount of side effects. With HIV, it is not the virus itself that causes death, but the opportunistic infections that persist. So early detection increases the chance for survival, as well as treatment, emotional support, and managing symptoms. These all can lead to a healthier life as opposed to having little or no treatment at all. As stated before, there is no cure, and short and long-term consequences depend on early detection, extent of treatment to help deter the opportunistic infections, and the individual's immune system. Early detection can also help prevent some of the infections that are likely to arise due to unknown or untreated illnesses. Scientists remain hopeful about the current treatments aimed at slowing the progression of HIV and decreasing the number of opportunistic infections. Because of this, people are living longer, more productive lives now more than ever. Here is a list of the local resources here in Gainesville that provide HIV testing as well as HIV counseling. And here is a list of references used in order to put this slideshow together.